Hi, everybody. Go ahead and come in. Welcome to our housing webinar, um, an organizational approach to voluntary services. We'll get started a little bit after 2. We're going to give everybody time to come in and get situated. If you would like to, you can drop your name, location, organization, and your connection to this work in the chat, and we'll get started here in just a short while. Thank you for joining us today. Hi, everyone. Thank you for joining us today. We're going to get started here in just a short while. We want to give people the opportunities to join us, but while we wait, we do feel free to drop your name, location, the organization you're with, and your connection to this work in the chat, and we'll get started. Thank you for joining our webinar, our housing webinar, and organizational approach to providing voluntary services. Hi, everyone. Thank you for joining our quarterly housing webinar, an organizational approach to providing voluntary services. We are going to get started here in just a few short minutes. We're giving everybody opportunity to join us. But while we wait, if you would like to, you can drop your name, location, organization, and your connection to this work in the chat. So glad to have you all with us today. Hi, again, everyone. Welcome to our quarterly housing webinar, an organizational approach to providing voluntary services. We're going to get started in probably about 2 more minutes. We want to give people the opportunity to join us. Again, while we wait, feel free to drop your name, location, organization, and connection to this work in the chat. Okay, it looks like we are about ready to get started. Again, if you're just now joining us, this is our housing quarterly housing webinar, an organizational approach to voluntary services. We'll go ahead and get started. If you have not done so already, you can drop your name, your location, your organization, and your connection to this work in the chat. Next slide, please. Okay, so we want to kick off this webinar by honoring the land that we are on today and the indigenous people and communities that have lived in our community and continue to live here on these lands. The map that you're seeing right now is a map of the historical territories and many indigenous communities. Freedom Network USA is located on the indigenous land of the Nacotchtank people and the Piscataway people, with our presenters located on indigenous lands of the Natticoke, Lenape land and the Narragansett land. We advocate for people to not only know which land you're living on that used to belong to the indigenous people, but we also would like you to consider donating to tribal nations around the world. Next slide. Okay, so today we're going to be, as you can see, we're on the Zoom platform and we are going to be using some webinar tools today. So first, we would like to let you know that we will be recording this webinar and it will go out as a recording in our follow-up email after this. So we will be adding this recording to our resource library as well. Another feature that we'll be using on the Zoom platform today is closed caption. These are available to your liking. And last but not least, we will be using the Q&A and the chat features. Our presenters will be taking questions throughout this webinar, so feel free to drop any questions using the Q&A and chat feature. Next slide. Okay, this webinar is being brought to you by the Freedom Network's Housing Training and Technical Assistance Project, which is funded by the Office of Victims of Crime, and we provide support and resources to service providers such as yourselves on the intersection of housing and human trafficking. Freedom Network USA is a national network of members providing services to or advocating for trafficking survivors in the United States. The Housing Project, some of the things that we do here is we host quarterly webinars on topics, like I said, on the intersection of housing and human trafficking. We provide one-on-one technical assistance to OVC grantees and their partners. We also have a resource library with fact sheets and webinar recordings such as this one that you can find at freedomnetworkusa.org, which we will be dropping that link into the chat. Feel free to sign up to our listserv to receive notifications when we've added new documents and webinars to our resource library. Next slide. Okay, today we have a great group of people here today. There's going to be our presenters today. I'm so excited to hear what they're going to bring to us on this topic, but I would like to introduce myself as your moderator first, and then I'll pass it to our presenters to introduce themselves. So first, my name is Shakari Dominique. I am a training specialist here with Freedom Network Housing, with the Housing TTA Project. I oversee the production of our webinars, and my pronouns are she, her. I, again, am located on the indigenous land of Nacotchtank people. I'm originally from Louisiana, and I'm currently living here in DC. And that's just a little bit about myself. I will like to say one of our presenters is not going to be able to join us today, Elena. We would like to acknowledge her contribution to this work, and we'd like to thank her for all that she is bringing to this work. You will hear from our Libby speakers today. I'll let them introduce themselves. I'll toss it over to Claire.
Hi, I'm Claire Macon. I use any pronouns. I am currently working as an organizer and a researcher. I'm an organizer with Ocean State Advocacy, which is a mutual aid-based organization working around sex workers' rights. I also facilitate a sex worker support group for female identified sex workers at Project Weber Renew in Providence, which is a peer-based harm reduction agency. I also have a history of research in specifically in harm reduction and in housing, and come to this work as a former housing provider. I formerly was a coordinator for an outreach program for LGBTQ youth experiencing houselessness, and before that worked in DV and human trafficking services in a shelter setting. So yeah, I'm really happy to be with y'all today, and I'll pass this to Eve.
Hi, I'm Eve Wing, and I use they, she, and he pronouns interchangeably. I am an organizer and cultural worker with Red Canary Song and Survived and Punished New York. Red Canary Song is a New York based group of Asian and migrant sex workers and massage workers, and we work to support massage workers who are currently in the work and facing violence. And Survived and Punished New York is a prison industrial complex abolitionist group that works to support survivors who are incarcerated and formerly incarcerated survivors of gender-based violence.
Thank you, and I can't not wait to hear from both of you all. So before I toss it over to our lovely presenters, I will review our learning objectives. Next slide. So some of the things that you can expect to learn today is an understanding on the impact for low demand and low barrier services and how organizations can adopt a voluntary service approach across their agency and to promote survivor autonomy, survivor choice, and establishing and empowering relationships among staff, allies, and survivors. Another thing you can expect to learn is the benefits and the challenges of implementing a voluntary service approach that positively supports service provision, staff retention, and when we're talking about challenges, some of those things, like meeting conditions of different funding streams this is something our presenters will cover today. By the time you leave this webinar, you will be able to identify methods to create multi-level buy-in within your organization and across partner agencies. And without further ado, I'll toss it over to our presenters. Before we start, Yves, I will say it seems like your volume is kind of low, so I don't know if we can adjust that for a bit.
Can you hear me now?
Yes, a little bit better. Thank you.
Okay. We can go ahead to go to the next slide. So we want to talk a little bit about what is a voluntary services approach, and also why is it necessary? Why do we want more service providers to take on this approach, or at least try to take on this approach and consider it? So first, that a voluntary services approach is based on the premise that participating in services should be voluntary and not a condition of receiving shelter, other housing services, as well as other services as well. Many other organizations require survivors' participation by making services conditional and expecting survivors to use resources in a predetermined way. Our example of this is that housing with the condition of substance use treatment, or also just stopping substance use altogether, as well as other conditions such that saying that, for example, giving cash aid or other forms of aid like that, like Visa gift cards, and then telling people that they have to use them in a predetermined way based on the organization. We need to challenge our beliefs about programmatic success and why we require engagement and participation. And when we talk about voluntary services, when we say low demand and low barrier, we mean that it's easy to access, or that it should be as easy to access as possible, that people who need these services are often people who don't have access to other services, and that when we're providing services, especially when we're talking about housing, shelter, food, regular necessities, that means that those need to be as low demand on the survivors themselves or whoever's getting the services, and also as low barrier to accessing them as possible. Next slide, please. So the core components of this type of approach is that we first have a housing first approach, that we think that housing is really important, that people having shelter is really important, that it's absolutely necessary to people's well-being, and that we have an empowerment-based advocacy and supervision, which means that we're working to not only empower the staff that's involved within service provider positions, but also the people who interact with them and people who are accessing these services. that the services are not conditional. Like I said, that we can't place conditions on people when they access these services, and that we can't place conditions on how they use the services and what we do with them. That it's individualized, that every person who comes to access your services are entirely different, have their own needs, have their own circumstances, and you can't just fit everybody into a singular mold as to how that will work. Nor is every single survivor the same, nor all of their needs the same, and are they're not facing the same types of trauma or issues when they interact with you. Minimizing power dynamics. So this is also understanding that you have to acknowledge the power dynamics that are inherent to a service provider position, and also just providing services of this nature in the first place. That you are in a position of power as a service provider, but also by trying to take on a voluntary services approach, you're trying to minimize the imbalance of power that exists within these dynamics. Survivor and staff feedback. So it's that you're listening to survivors who are accessing your services and the staff that work within your organizations in order to change the models for which you're working, to make things work better, to make things work in a way that is actually centered on people and life affirming, which takes us to the centerpiece, which is that it's person centered, is that it's always going to be centered on the people who are interacting with these services, who are providing these services. And also, we should have an acknowledgement for the fact that a lot of staff who work in these organizations are themselves also survivors, or themselves who have also faced violence. And that's often why they work in this work in the first place. Next slide. So first, we're going to look at this sort of flow chart, and then we're going to go and do a little bit of an activity associated with this. But first, we want to talk about kind of the spectrum of voluntary services. So what we mean by the spectrum of voluntary services is that voluntary services does exist on a spectrum. You don't necessarily have to start doing a policy that is completely a part of this value frame from the beginning. It's kind of working from certain places where you're trying to chip away at these power dynamics and at some of these different policies that already exist. And so when you start thinking about where you can look at making these changes, or how you can approach a voluntary services model, this is like sort of thinking about how do you do that. So first, we look at a particular policy or practice within your organization, and you ask yourselves, why do we have this policy or practice in place? Does it align with our values? In this case, we're looking at not only your values as an organization, but also when we're talking broadly about voluntary services, about low barrier services, those have very particular values attached to them, which for us, the presenters here, the type of work that we do is rooted in mutual aid work that was done by mainly Black and Brown, Indigenous, trans, and queer folks, and how they supported their own communities. And so those are the values that we look at. And then when we look at it, how does your funder require it? So what do your funders and the people that you're beholden to require certain services to look, and policies and practices? Where can you make changes? Can you make changes to this policy and practice? And then you ask yourself, how does this help survivors? Does the policy and practice help survivors at all? Does it harm survivors? Where is it harming people? How does it harm people? And is it a mandatory requirement? So we're also asking, when you look at, does your funder require it? So you're looking at, is this a mandatory requirement for the organization that you work for the funders that you have? So if yes, how can you make this easier for the survivor, even though it's a mandatory requirement, even though it's something that your funders require? If no, can it be changed? Can it be made better so that you're lessening harm, so you're minimizing harm? And if so, how can you change it to best support survivors? So now we're going to go to a Jamboard, which Shakari will drop a link in the chat to, and we'll do a little activity surrounding the Jamboard. And if we could bring the Jamboard up on the screen share, that would be great. Thank you. So once you all start opening the Jamboard, what we're looking for is to kind of think through this flow chart on your own and put it on a sticky note. You don't necessarily have to do all of it. We know that that would be a lot on one sticky note, but you can first kind of like, or at the very least, write down a policy or practice that comes to mind for you that you want to reflect on. And then also kind of think about those questions that we brought up, and mainly also thinking about whether or not you could change that particular policy and practice. So we'll give you a second to do that. So I'm not fully sure what's being written out on the Jamboard at current, but you can actually type your notes onto little sticky notes if you see this on the square that's on the sidebar. So we're starting to see some things come in, which we have mandatory drug testing for services, curfews, curfews for safety reasons, client closure policy. I don't know if anybody wants to drop in the chat what they're thinking about these. I can certainly imply and guess exactly what you mean by it, but if you want to drop in the chat, like what you think about these policies, whether you think that they're harmful and you want them to change, whether you think that you couldn't change them because they're a mandatory requirement. Some more, we have visitor policies and ongoing follow-up. Housekeeping responsibilities of the living space. So Amy said, for client closure policy, would like to look more into it, if not engaging in the case management services after addressing challenges. Is this meaning voluntary services approach or not? We have number of occupants allowed. We'll also be revisiting this like Jamboard of your responses in a little bit as well. So you all can keep typing there a bit as well while we also go back to the presentation. Requirement to be in drug rehab or 90-day programs to get housing or mental health services. You go to the next slide. So next, we're going to talk about the benefits and challenges of voluntary services, because it's certainly, while we think that it's certainly the policy that people should have, should be the model for which service providers use, there are definitely challenges to this model of trying to provide services. Next slide. So first, we want to discuss what is the necessity of low barrier services and what we're doing. So first, and when we say we mean service providers, advocates, legal representation, anybody who would interact with survivors in this particular way, are supporting people in self-determining and self-advocating. We're not saving people. We're not in the position of saving people. If anything, they are supporting themselves, and we're there to help them through that. We're there to help them make those decisions for themselves and to advocate for themselves. And the point of low barrier services is to encourage individuals to seek resources by eliminating obstacles. So we want people to be able to access the services that we're able to provide by eliminating any obstacles in their way to getting that, on top of understanding that those obstacles serve as another layer of harm or issues that survivors can face when they're seeking services. And life-affirming, life-saving necessities should not be based upon conditions. Again, we continue to reiterate this, that life-affirming, life-saving necessities like housing, right? Food, clothing, all of these different things should not be based upon conditions, should not be conditional at all. And often a lot of service providers who are part of organizations that get government funding often require a lot of conditions for people to acquire those types of services, those necessities, also partially because they know that they're life affirming, that they're life saving, that people couldn't survive without them, and that creates a really harmful and coercive dynamic between service providers and the people who access those services. Go to the next slide. So what are the benefits of implementing voluntary services?
I think we missed a slide just before that.
Okay. So voluntary services approach within an organization. So what does this look like within your organization should you use this approach? A voluntary services approach centralizes survivors and is meant to reduce potential harm to both survivors and staff. So like we said, often when services are conditional, when they're not low barrier, when they're not voluntary, they're coercive, they're harmful, and they prevent people from self-determining, from life-affirming, and from being able to access the services that they need. And because they do not want to have those conditions, or those conditions limit them from being able to use the services in the way that best suits them, which we believe that survivors know what best suits them, that they know what they need the best, that they know how to self-advocate, that they know how to self-determine in the ways that are best for them, and that we are not in the position to decide that for them. Of course, we love to have a conversation between staff and people who are accessing services. However, that doesn't necessarily mean that you should be coercing them or demanding that they live their lives in a particular way, that they should do certain things in order to, again, access life-saving services. And the housing assistance system can strip survivors of a sense of control over their lives by mandating participation to access housing, mimicking the power dynamics of some trafficking experiences. So for us, when we look at this, we think that a lot of housing assistance programs tend to strip survivors of a sense of control by expecting them to live in certain ways. Like we said, many of you on the Jamboard brought up those things that happen in this way, right? Whether it be housing meetings, whether it be limitations on how many people can come through housing, whether it be limitations on the ways in which you can live, having your housing look a certain way, right? Having certain cleaning conditions. And also, again, many people brought up drug testing, brought up mandatory drug testing and on sobriety and expectations about how people should live their lives in order to access certain conditions. And that again mirrors dynamics that survivors have already experienced, especially when we're talking about trafficking survivors. But this also applies to other survivors. I work with incarcerated and formerly incarcerated people, and we know that the prison system strips away people's humanity, strips away people's ability to determine for themselves the way that they should live, and are constantly surveilled. And we want to minimize this as much as possible in order to actually create an environment in which people can access services, in which people can heal, and in which people are able to like better their lives in some meaningful way. And human trafficking survivors can be stripped of their autonomy by social services, by police departments, by ICE. And our intervention is crucial in this, right? But the work is not to rescue people. We continue to bring this up and emphasize that we're not saviors in this work, that we don't rescue people, that that's not what we're doing. That the intervention that we provide is crucial as people who are service providers, but that doesn't necessarily mean that we're doing the saving here. Rather, we're supporting people in the choices that they make, again, to affirm their lives and for them to continue to survive in the ways that they deem is best for them. And again, like we said, supporting people in self-determination and empowerment is the work. The work is not rescuing people, is not being a savior for somebody, is not doing all of that work. We're supporting them in doing that for themselves. Next slide.
Thank you so much, Yus. Yeah, so a lot of this is kind of like reflecting what you said. There's these feelings of autonomy, of empowerment, of agency for survivors. We just kind of want to list out like the ways that this is beneficial, not only to survivors, but also to the organization and the organization's like existence. It's a huge piece in like creating a sustainable organization that people are happy and excited to work within. So just to look at the survivor focused benefits, we've talked about this a little bit before, but restored feelings of safety, choice, and control. For so many survivors, that element of control and agency has been stripped from them in different ways and in different circumstances. And so much of our work is restoring that and supporting folks in being able to self-determine, being able to make their own autonomous choices, of not directing them in pathways based off of our perceptions of what they need, but letting them determine that for themselves. This creates better long-term outcomes for survivors. The goal is not to have survivors linked up to social services for however long. The goal is for people to move on in their pathways, whichever works best for them. And when we're thinking about like what this means in terms of sustainability, we have to like think about letting survivors have choice so that later on, 5 years, 10 years down the road, they're able to kind of just continue on that self-determined pathway. Creating space for diversity and lived experience. Unfortunately, a lot of service agencies like really homogenize the survivor experience, right? And survivors are coming from all different experiences. It is impossible to look at the numerous ways. And so all we can do is really listen and make space for that, and not just try to put everyone in these boxes to make it easier for ourselves, because ultimately what that does is it hinders the ability of survivors to be able to have that self-determination, like what we've been talking about. We cannot homogenize survivors. I cannot say that enough. And we see this happen so often, but it's really limiting. People are coming from all different backgrounds, and that means that their futures will all look different, and that's okay. Also valuing the role of peer leadership. Having the perspectives of peers in this work is invaluable, just in the sense that like when we're thinking about the long term, we want people to be able to see all different sides of that pathway. What does my journey look like 5 years, 10 years, 20 years down the road? And peer leadership is a huge piece in that, as well as being able to kind of check the organization and maintain the organization as being survivor focused, right? How do we create a survivor focused agency? We value peers, and we pay peers, and we lift up peers in this work. A lot more benefits are, here's some organizationally focused ones. Decrease staff burnout and turnover. I don't know about y'all, but in my time working in a shelter, I felt like I was a RA or like a security guard, and that is never something that I want to be. I'm not here to tell, adults when to be home or how to clean their houses, people who know more than me, right? And so when I'm saying that these, like, creating a voluntary approach invests not only in the survivor, but also in the staff, it makes it so that staff are able to focus on their goals as advocates and not be working to just create these roles as enforcers, and specifically looking at the way that survivors have had to deal with the idea of an enforcer, whether they're in experiences in trafficking, through institutionality, through incarceration. We don't want to replicate that dynamic. And that means that we can have healthier relationships between folks working at the organization and folks who are accessing services to the organization. It just makes it a more collaborative, healthy work environment that feels ultimately more sustainable. Decreased chance of staff occupying dual roles as an advocate and disciplinarian. We are here as to be advocates. We are not here to be disciplinarians. And when we cross back and forth between those two roles, it's not conducive to healthy communication. It's not conducive to a relationship that is productive. It really just kind of sets us back a lot. And so many of our folks, like I was saying, are working through, institutionality from day one, whether it be the foster care system, incarceration, ICE, their own experiences of abuse within their life. Like, we don't want to be another example of that. And the goal is not to just push people along in the machine of institutionality, but to allow folks to choose where they're going to go. And so we cannot replicate that dynamic. Also, just increases in training opportunities for all staff. We're in this work to grow, and to be able to be in this work and continue growing by continuing to change your framework. When you think about the ways that this work has existed over time, it's continuously growing, it's continuously changing, and we don't want that to stop. I mean, so much of that is by centering the work of organizers, the work of people in the community who have had such a depth of experience in this, and we want to be able to kind of increase that opportunities for training in our staff. Next slide. Challenges of implementing voluntary services. So, we understand that this is challenging. We understand that the way that social services are set up is not to reflect this voluntary service framework in the way that we envision. And so through this process, it's definitely not easy, especially because most of these organizations, most of y'all are not starting from scratch. You are rebuilding an already existing organization, and that change can be really difficult. So looking at survivor-focused challenges, survivors have different needs and services to meet their goals. How do we expand? How do we grow in those different directions? And so much of that is calling in other organizations, whether they be other nonprofits, community-based organizations, just supports across all different needs and services to be able to support people in that process, but just acknowledging that that will come up. We will have people who are going through things that we don't have an answer to, and that's okay. And it's just about the process of working through it. The desire for more authoritarian or strict program within mandatory services. So less than this being a desire, it's more so just something that many survivors are accustomed to, and that is kind of just due to the way that existing within institutions really works to penalize people, to discipline people, and to keep people in this positioning of the enforcer and the person being enforced. So that can be kind of a shift for people, especially people, like I was saying, who are coming from the lifetime experiences of existing within the institution, whether that be through foster care services, whether it be through incarceration or any of the other. That is something that is important to name, and important to name as like a shift, right? We can't just negate that this is a change that's happening, but I think that it shouldn't deter us from continuing on this pathway. And fear of negative outcomes. We're in this work because we care about folks and because we want to see folks succeed in the best way. But ultimately, part of understanding that people's choices are self-determined is acknowledging that people are going to do what people are going to do. And that's more important than us having a say of where people go in their lives, right? So yes, we can have like a fear of negative outcomes for folks who are in this kind of newer like area of having more autonomy, of having more agency. But the way to deal with fear is not to kind of like bring the hammer down more. It's to just be able to, once again, have those conversations that are enabled by creating trust, by creating discourse, and see where that leads. Organizationally focused challenges. So speaking from my own personal experience, once again, in a lot of social service organizations, there can be this really like old guard mentality in service provision. This is how we've always done things. This is how this works. This is how this doesn't work. And that creates a lot of tension, right, between the staff and the clients and just all around. That is really difficult to change. And once again, like, we're not starting from scratch. We are like working within institutions that have been doing this work for a long time. But that's why, and looking at kind of the pathways that Yves was laying out earlier, it's a piece by piece experience of saying, okay, we want to make steps in this progress. So how can we break this apart piece by piece and challenge these so it feels like people can feel heard along these changes and it can have a more successful outcome. Meeting the conditions of competing funding streams. This is so challenging for all service providers, and we understand that there is incredibly limited funding and resources. However, that does not mean making like adjustments that will actually be harmful for survivors' experiences. If a funding stream is asking you for something that feels exploitative, or it feels like you're kind of going back to that more involuntary service model, how like really evaluating what that means and how responsible is it to accept that funding stream in terms of looking at the future of both the folks who are accessing services and the organization itself. Oftentimes it really sends mixed messages to both staff and to both people accessing services to be able to kind of have these progressive policies in one direction and then antiquated, funding streams that are pushing us back, right? So we just need to keep moving forward. And once again, as Yves was saying earlier, think about how if we are using funding streams that are asking for a lot of like different reporting and things that like feel kind of in conflict with a voluntary service model, how can we be creative in working around that? Fear of negative outcomes enabling harmful behavior. We need to delineate from this idea that we're the enablers, right? We are not anyone's parents, disciplinarians, nothing like that. This is not a relationship where we're acting as enablers. Folks are going to make the choices that they're going to make, and that's important to self-determination. All that we can do is act as supports and resources, and that is a part of providing rights over rescue. You know what I mean? And so when we're talking about enabling harmful behavior, we have to get away from this mentality, like as if we have control over someone, because that is what, when we're talking about enabling, that is what that brings us back to, is a sense of control that doesn't need to be there. Limited resources. We all experience limited resources in this work, and the way that that comes up in terms of burnout, in terms of staffing shortages, in terms of feeling like, we can't do enough for how much the need is. It's totally real and it's totally fair. Ultimately, a lot of this is like about, first of all, being able to make those outward referrals and being able to recognize where our limitations are in the work, but also being able to say, how many people can we effectively serve? The need is always going to be there, but if we're pushing ourselves beyond our limits and we're working on drained resources, that's only working to harm. It's not working to support. And so, for example, when you're looking at like shelter policies, oftentimes there's a lot of congregate shelter. And if we're looking at a shared bedroom of 3 or 4 people, and that's seeming like it's something that's really creating a lot of challenges, it's kind of pushing us in this more involuntary services method, people are feeling kind of like not good there, then it's okay to say, like, we need to cut this down a little bit and serve fewer people in a more supported way. And if that doesn't meet the grant outcomes, like ultimately we're here for the survivor and supporting the survivor. So I think that these are some really hard conversations that need to happen within the organization about, if the limited resources are so limited, how do you change your scope of support for survivors to reflect that resources, as opposed to overreaching in areas that aren't necessarily going to meet survivors' needs. Next slide. So implementing a voluntary services approach. How do we do it? So what are organizations' values and mission? This is honestly, if I could tell you to screenshot one slide throughout this entire thing, I feel like this would be one of them. But this is really what we're grounding ourselves in making these choices. Do you believe that housing is a human right? Housing is a basic necessity, point blank, period. And like, that's like how we come to this work, right? And so that is just a core value. Do you understand why some people end up in criminalized labor or demonstrate poor behavior? Do you have an analysis of power? Do you believe in honoring how people survive? This is just going back to kind of just being able to have respect and understanding for people's self-determination, people's agency, and what people's lived experiences look like. This is another way that when we think about peer leadership, we're able to better implement these kind of ideas, because when you have folks who have lived experience within the organizational setting, we are better able to focus in these missions and these values, because people are living in these values and these missions in a way that is different than entering as a service provider solely and not a person with lived experience. Do you believe in survivors' autonomy and self-determination? This is such a huge piece to this work. How do you separate your values from your work? This work is challenging, and it challenges us daily, right? As people who are not only service providers, but as people who exist in community and family and partnerships. What my norm is might not look like my coworker's norm, might not look like somebody who's accessing services norm, and that's okay. But what that doesn't mean is that mine is better or right or more valuable than somebody else's. And we have to, like, so much of what I believe is kind of informed by the way I've grown up, and so then the way I've lived and the way I've experienced. So we need to be able to have respect for other people's lives and pathways, and be able to have a separation in our values, and being able to let people self-determine. And then, how are your values shaped by mainstream political, moral, and ideological understandings of human trafficking? We're living in there's a lot of intense rhetoric around a lot of human trafficking, and a lot of that really gets mixed up in, a lot of moralistic ideas and political motivators. And how are we able to separate that from the people that we serve? How are we able to understand that what's happening on the news is causing an effect, and we need to dismantle that before we go into these settings where we're working with people, because our work has an effect on people's lives, and we don't want that to be a negative effect based off of whatever is being put out there in a mainstream political way. Next slide. All right, so organizational buy-in. I'm not sure kind of where everyone is coming from in this work, but I understand that a lot of folks are coming in from different points on, so we have some managers, we have some direct service workers. So we're all kind of at different areas with this, and that creates kind of a different relationship in terms of organizational buy-in. We're talking about organizational buy-in, we're talking about assessing agency values to determine the needs for organizational change. Most agencies, including the agencies that I've worked for, have a set of values, and that is a great starting place to say, what are these values? Are we practicing them? And how can we change to make sure that our values align with our work? Holding informative sessions about voluntary services. We are not asking for these changes to be made in a day, and we understand that it's a long process, but being able to kind of lead staff along in that process is really valuable in terms of the long-term sustainability. I've worked in harm reduction now for a while, and harm reduction is a word that really gets thrown around a lot these days. And when you see folks in different settings, you're recognizing that, like, the word is not aligning with the practice, right? And that's where the information is so key. We can't just use this word voluntary services without having some punch behind it, without making sure that folks understand what that looks like in practice. And that means investing in our staff and making sure that there's long-term success by making sure that everyone's on the same page of what this looks like on a day-to-day operational level. Evaluate the organizational level, where you were able to begin making in micro level changes. This is picking apart every piece of the organization, from funding to practices, daily practices, to case management, to whatever your organization is working to do, being able to look at all different pieces of it and evaluate where this has a hand. Seeking input from staff directly impacted by organizational changes. Staff need to be able to have feedback, and that feedback is hard, but it's so important. Begin implementing the organizational change. Start slow, keep it going, and then measure effectiveness of the change by collecting staff feedback and holding ongoing listening sessions. Continuing on with this, staff feedback as well as feedback of folks who are accessing services, right? These are both really valuable to implement. And if you're saying that you're doing volunteering services, but the feedback that you're getting from both staff and folks accessing services is, no, this isn't actually working for me, that's actually not going to be like, we have to evaluate the practice. And if it's not aligning for all the different pieces of the puzzle, then it has to go back to the drawing board. And it's arduous and it's complicated, but in terms of looking at like a long-term best outcome, this is what we recommend in terms of that. Next slide. Thinking outside the box. So a lot of these recommendations that we've made have been like, in some ways feel like maybe they're challenging to the current way that the organization is functioning. And so that's kind of why we're thinking about how to subvert that. So diversifying funding and measuring outcomes in a voluntary services model, looking at places that don't necessarily seem like traditional spaces as a way of being able to have funding that better reflects survivors' needs. An example of this is I'm working off of a grant right now that is supportive in creating a support group for female identified sex workers. The grant that we are working off of is a wellness grant, and it's a wellness grant for overdose prevention. How are we able to look at this group that this serves and be able to implement these ideas and be able to have extra funding that's sourced that doesn't push us back into the old method of carcerality that's been so replicated in so much of social service work. Partner with and support community organizations already doing the work. I can guarantee there's so many people that are not like, there's such a disconnect in so many different communities between community organizations and social service relationships. And so often the reason for that is a lack of kind of like ability for the social service provider to see how valuable the community organizations doing the work are and how valuable they are in terms of helping both organizations or both groups achieve their goals. So in terms of thinking about partnership, that's back to referring out, being able to say, you know, we can't do this thing because of the way we're limited, but you know, who can is this other person. Being able to invite community organizations to the table to evaluate, you know, voluntary service practices, be able to say, I've heard that y'all are doing this thing and why is that? Being able to create a discourse that's more community-based and doesn't just limit itself to the structure of the nonprofit industry. And then when applying for grants, developing programs and designing outreach and training material, include survivor voices. This is really a space to really reflect the diversity of experience in survivors. What that looks like in your community might differ from community to community, but including the survivor voices is a way to really say, look, like we're doing this work, we're serving folks, this is what our folks want, and this is why we need the money, and this is how we're gonna do this, as opposed to just limiting folks to being statistics, being figures, including survivors in this process and saying, how can we have this organization be more survivor focused and being survivor led? Next slide.
I think this one's mine.
Yeah.
So next we're talking about how do you apply it? How do you begin to do this, right? And so how do you begin to apply a voluntary services approach to your organization if it's not already there, if it's not already a part of your like alignment, right? So first, say like creating a brainstorming session among the organizational staff, right? So again, like we already took you through that flow chart earlier, and we'll revisit the flow chart. And had you look at the Jamboard, but that's sort of the beginning of this brainstorming, is looking at your different policies and practices, which can be many, right? And you kind of start chipping away at it to think about what you're doing. And so then you can collectively identify the strengths and areas of growth needed among the organization in order to push yourselves towards a voluntary services approach. And also, like Clarity brought up, right? Evaluating your current funding and funding requirements. So looking at your funders currently, what do they require? How do those not align with a voluntary services approach or align with the values that you're looking to put yourself in more alignment with? And where can you find other funding? And also where can you work around the current funding requirements, right? Like how much can you shift the current dynamics that you have under the requirements that you currently have? And then also looking from year to year budgets, right? As you continue to apply for grants, as most organizations do, continuously applying for grants and looking at different streams of funding and trying to find alternatives for you that can then reduce those requirements requirements or allow you more freedom as an organization and as staff to be able to take on a voluntary services approach, which there aren't necessarily a ton of different like funding sources via granting that necessarily have no requirements, but there are a growing number of them around the country that do provide this type of granting. Or you can look creatively, like the example that Claire brought up around like wellness grants, working towards like sex workers, because you're able to apply certain grants and funding towards your organization, even if it's not necessarily directly what you're working on, as long as it can be applied, as long as when you apply for it, you understand how the demographics of the people that you're serving, the survivors that you're serving, can like fall within that, right? And so also identifying if the organization's supervision structure centers the staff or the organization. So what we mean by this is that, how does the structure of your organization work? Does it center the people who are doing the service providing? Does it center the staff who are working? Or does it center the longevity of the organization, right? We often see, I'm sure you all know this, right? As people who have probably career long worked within the service sector and been service providers, know that burnout there's a lot of burnout within this type of work, and that there's also high turnover. Most shelters, most organizations that do harm reduction, most organizations that do social work of any type of sort or anything like that has a really high turnover rate. Usually staff does not stay there long unless they are like a person who just happened to stay with the organization for a really long time. Often there's really high turnover for advocates, or really high turnover for different types of positions within these organizations. And that's often because the supervision structure of an organization privileges the organization overall, the longevity of the organization, and like the way that organizations work, right? In order to best benefit whomever runs the organization, not necessarily who keeps the organization running, which is to say the staff that do the service provision or staff that like do like regular maintenance are often interacting with the people who are accessing services in the first place. And so it's not looking towards what's best for people who work there. It's not looking what's best for survivors, but it's looking for the long-term view of the organization existing. And this often happens. And we can move to the next slide. So we're looking at this flow chart again as we think about it, and we can move back to, if you all want to move back to the Jamboard, which Sakari just dropped again, as we can kind of revisit what we mean now that we've gone through a lot more of the slides, and you kind of get a grasp as to what we mean when we say that you can implement a voluntary services approach. So if we could move to the Jamboard, that'd be awesome. You can actually go back to the other one that we had before with the other C notes. Yeah, so now that we've gone through more of the process of how do you implement, how do you think about it, what do you need to, before you even begin the process of looking at this, right? The questions that Claire presented around like, what are your values? What are your organizational values? And the truth, again, when we say we're talking about the supervision structure of the organization and how it might work against the staff and it might work against the survivors who are accessing the services, is that oftentimes the structure and the value alignment of the organization isn't actually in alignment with a voluntary services approach. The things that they want, the things that they're trying to push out aren't necessarily in alignment, even if the staff is in alignment, right? Like you as individual staff members might have more alignment with this approach and this model than the organization currently does or has, right? So we're kind of revisiting the answers that y'all provided here and looking at, again, how do you look at these policies and determine whether or not these are policies that are conditional, or if these are in alignment with a voluntary services approach, which I would arguably say that most of these are not in alignment with a voluntary services approach, right? Like I'll just say that off the top, right? But there are questions in the chat that I've seen asking that question, and the way you can go about that is by having a very clear view of why we do a voluntary services approach in the first place, right? What is the reason we're doing it, which we've constantly said. is about self-determining, life-affirming services, honoring the way that people survive, understanding that these are life-saving necessities, that they can't be conditional because every person has the right to these things, and that we want people to survive, even if they don't live in the way that necessarily we want to, or that the organization wants them to, or even just like what mainstream, like political, ideological, like different like alignments would tell them is the best way to live, right? So when you look at all those things, you can deem for yourself whether or not having ongoing follow up, having visitor policies that are conditional, having a restriction on the number of occupants allowed, having curfews, having house meetings, having drug testing does fall under that if that is in value alignment with these things. And again, we also bring back as to why this is important. It's not just a saying that life affirming, self determining is important. It's also that that is a part of the value alignment, is looking at people's humanity and seeing that humanity and honoring the way that they survive, and also honoring the fact that a lot of the people who access these services are people who, like Claire said, are people who have had a lifelong interaction with these types of institutions, and often have a lifelong interaction with these institutions because of oppression, because of marginalization, because of certain like dynamics that they have, right? And especially when we're talking about trafficking survivors, right? We're looking at people who are survivors of gender-based violence. We're looking at people who have encountered poverty, houselessness. And when you understand that, you know that we have to think about it as you're not at fault for doing those things, and you can't like look at people's behavior just as like a problem, and that they are the problem, or that they are the reason why they do things. That's why we provide services in the first place. Again, not because we're trying to change people, not because we're trying to force them into anything. It's because we honor people's lives, we honor their survival, and we want people to survive, right? And again, like we have to honor their choices in that. So we can move back to the slides. And go to the next slide. So in this, we're kind of talking about what do we mean when we say creating the process together? When we say we're creating the process together, we mean that it is thinking about survivors and staff working together to create what is best and what we can think about. And again, this might change, right? We don't necessarily think that a voluntary services approach is concrete in that you might implement some of these things and never change them. The point of a voluntary services approach that is low barrier, that again is life affirming and allows people to self-determine, is that you're co-creating, and that it changes as the needs of survivors and staff necessarily change, or that you get feedback, right? And so survivor focus, that you're building trust with survivors and reducing the chances of re-traumatizing survivors. So when we say this again, like the process and the practices that you have in place need to be about building trust with survivors and reducing the chances for which they re-traumatize people. And like we said, for a lot of people interacting with these institutions, whether it be legal services, whether it be through criminalization, whether it be through all of these different institutions, often those institutions re-traumatize survivors, ask them to retrench their trauma, or again, recreate power dynamics that they have already experienced when being trafficked, or when they were experiencing like the prison system, when they were in incarceration and things like that, right? So we want to reduce the chances of re-traumatizing survivors by providing them with services for which their humanity is acknowledged and in which they can make choices for themselves, right? So survivors have the opportunity to provide input that can positively affect their success and program outcomes. Is having conversations with survivors so that they can tell you what works best for them and what they need, right? And this also applies to the services that you provide, right? Obviously, to some degree, these things can't change, but you very well could be providing services that people don't want, right? Or don't need. So you're often looking and thinking, why are people not interacting with these programs? Why are people not wanting to interact with these services and take in the resources that we're providing. And that's because you're not providing people with what they want, with what they need, with like even like culturally competent services, right? That like you could be interacting with people in a way that has like no bearing on their life and on their culture and like their community. So then they don't want to interact with your services, and you just sit there and kind of ask yourself about it, but really like allowing survivors to have that input in their own success, and the program and what programs are available will like change that process for y'all together. And then when we're talking about organizationally focused, acknowledging the position as a service provider is a position of power with the intent to share the power. So when we talked about this, I brought this up earlier, is that as service providers, you all are in a position of power, even if yourself, you have had lived experience of these things, right? Which I acknowledge is a thing that is very true. Many service providers are people who are themselves have lived through these experiences, have come out the other side, and that's why they became a service provider, right? That you're emotionally invested, that you're morally invested in this structure, in like doing things about this, but you still need to acknowledge that you're in a position of power, but that you want to share that power, which again, like is actually something that people have to think about, that has to be unpacked, because often a lot of service providers don't unpack this and don't try to share power, which again goes back to things that Claire said, which is that Claire kind of talked about how we need to reduce the role of service providers as disciplinarians, but there are many service providers who like want to be disciplinarians, who do interact with people in this way. And really, you need to be unpacking that and chipping away at that and have an intention of sharing power, not only with with the survivors for which you provide services to, but also as staff, right? That you need to be breaking down like the dynamics that you have as staff together. And then, like we said again, this work is not to rescue people, it's to support people in self-determining how they succeed. So we're not here to determine the best way for people to live. We're not even trying, for us, for our value alignments, we're not trying to get people to like immediately leave different circumstances, whether that be drug use, whether that be sex work, whether that be interacting with certain things and certain types of labor and certain types of people. That's not what we're here to do, right? We're here to support people in deciding for themselves what they want to do and how they will succeed. And we fully believe that people want to succeed themselves and know the best ways for them to do that. So we can go to the next slide. So we're just, if we have any questions, we know that there were questions in the chat. We know that people sent questions prior to this. So we'll open it up for the Freedom Network staff to like address the questions that have come through, and Claire and I will answer them if we can.
Okay, before we dive into questions, I just want to say this webinar has been intriguing and a wealth of knowledge, and I want to thank our presenters for being here today, for preparing this content, and for delivering this content. So I know I've taken in a lot of information, and I know about voluntary service and how organizations could apply this, and have seen this content, but also to just be in the audience and on the listening side of it, it's really good. So I just want to thank you both for being here. We did have some questions come in. So I know in the chat we had a question from Amy, and I think it was around case closure. If a survivor is not engaging in case management, is this meeting voluntary services? Yves, Claire, did either one of y'all want to? You both can take it. Did anyone want to take it?
I mean, I
like
guess. Go ahead.
I just wanted to say that I think that that question kind of goes with another question that I saw in the chat that I think Mallory asked.
Yes, Mallory did ask a question, and I can read her question if you want to get both questions. Okay, so Mallory did have a question. She says, if a shelter has a policy of 6 to 8 months stay with the access to supports and resources voluntarily, and the resident chooses not to engage in those supports or determine steps to move out of the shelter, how do you navigate exiting from the shelter? And she does have a couple of follow-up questions too, but I just wanted to ask that one question first.
Claire, you can go ahead.
Oh yeah. Okay. So kind of like going for the question from Amy first. I guess like my first question is in terms of like not engaging in case management, like does this look like and I guess when I'm like asking these questions, I mean it more in a rhetorical sense. Like, is the person physically showing up to case management, but not following through on whatever goals that they're setting or what have you, or are they physically not showing up? And kind of maybe like looking at and trying to work through like what are those deterrents? And I think this like what kind of goes into the thing that Mallory asked is this idea that by like opening dialogue and making dialogue the main piece of saying like, look, like these are the shelter policies. We're not trying to threaten you. We're not saying you have to like do XYZ, meet XYZ. We do just want to recenter around like these being things that we need from you in terms of like moving forward. How can we support you in that, and opening it up so it does feel like that self-determination of saying, okay, how can we support you in transitioning to your next phase? How can we support you in meeting the goals in your life? What are these goals? I also, the 6 to 8 months thing in shelter specifically really resonates. I do recommend challenging that policy. In the current housing climate, I'm not sure where you're based, but I can say I'm based in Rhode Island, and 6 to 8 months is not enough time for folks in shelter to find a sustainable living environment, whether that be through federally funded subsidized housing or project-based housing. The lists are long. And so in market rate rental is even worse. And just understanding when we're asking folks 6 to 8 months, how that might create this sentiment of like shutting down because it feels so impossible. But that's because it is so impossible, because this whole like system is so overwhelmed with need right now. So I do recommend challenging where that comes from, and if that was something that existed at a time when we were not at our current point of like housing in access, right? And so those are a couple of suggestions. Ultimately, these are super like client-based questions. I do think that it differs from every client, and we can always go back and forth about kind of how to workshop these issues. But I think that I think creating conversation will always kind of lead to the next steps, whether they be next steps in like a more concrete way or an abstract way. That's a jumping off point. And in terms of like not engaging, like what are the deterrents to engaging? What does engagement look like? Is engagement something that's being measured by the agency? Is engagement being measured by something that the person is saying? Does the person feel like, oh, I am engaging because I'm following all these rules, but I'm just not showing up to case management? Kind of looking at what does it mean to engage? What does it mean to be having like a next step? And then from there, jumping off into a dialogue that feels more based around opening up with like tools like motivational interviewing, which I feel like is always a suggestion at this point, but a suggestion for a reason. And then kind of going from there. That was a lot of answer.
The reason I wanted to kind of group these questions together is because I feel like they're trying to kind of get at like, is this a voluntary services approach? Is this voluntary if this person disengages, right? Which obviously that is a choice, but I think that also getting to what Claire is saying is that people can make those choices for circumstances surrounding them, and that we necessarily need to look at in order to address it, right? Is why are people not engaging with services? Why are people not engaging with case management? And like, are there things surrounding that? Because the truth of the matter is that it's not enough for you to simply present people with options. Like it's not enough for you to say, oh, well, it was available, or like, oh, we invited this person to do this. Like it's also about what are the barriers and obstacles that are stopping them from interacting with these services? What is like the barriers stopping them from interacting with case management, and how do you make it more accessible? Which isn't to say that you all need to take this on, right? Because it's a lot of work. It's more work than one person can do. And it's also long work, especially if you're looking at some of the suggestions that we're bringing to the table about questioning certain policies and practices about like a 6 to 8 month stay. or things like that, right? That take a long time to change. But also, it's a question that you kind of need to continually ask yourself. And like I said, the kind of thought process around it is like chipping away at these sorts of policies and practices to make it better, and hopefully over time get to a place where you are approaching a better voluntary services approach, a low barrier services approach, right? And it's better to chip away at it and do something than do nothing, and also to question it than to not question it at all.
Something that Eves has been saying that like kind of I just brought up some stuff for me. I think that looking at like what is your next steps also needs to be broadened out, right? And understanding that a lot of times what next steps looks like for case managers is here's a stack of housing applications, and you need to get your documents in so you can go enter the Section 8 list and you can go from there, right? But in terms of looking at like a broader scope, what about saying like we've had folks I've worked with who said, okay, I actually want support in getting transportation so I can move to Tennessee and I can live with a family member there. And that's what looks like the positive next step for me. And how can I help get support with that? And just understanding that kind of like day one, let me take your IDs, let me take a scan of this, let me give you the housing list, and it's like that kind of rote pathways are really, they don't work for everybody. And I also think too, kind of going back to the timeline aspect of it, in understanding the diverse experiences of trafficking survivors, specifically in organizations that I've worked with, we've worked with so many folks who are experiencing being undocumented and kind of navigating a different system, not only just the system of like the current housing system, but also the documentation legal system. And so I think understanding that like that is not going to fit in 6 to 8 months for a solution, right? And so this is kind of also where that piece of like the diversity of lived experiences really does inform how you support people in their process. And I understand that when folks are entering shelter, it feels really important to set out this very like, okay, and here's the finite rules as a protective mechanism. And I mean that in like very like air quotes, because it's not actually protecting people. It's not protecting the organization. It's not protecting the survivors. It actually does a disservice. And I do think that by kind of looking away from those really finite things, we're seen as more of like people who are working in collaboration as like rather than people who are just kind of a bus stop on the pathway. You know what I mean?
Yeah, that definitely makes sense. So we did have some attendees submit questions before the webinar, and I'm going to ask a couple of those as well. So one of the questions is how to provide services to folks with mental health issues without being able to require other supports to be in place. And you may have answered this in the previous questions, but I did want to ask it again. And I can read the question again if need to be, just let me know.
I can start a little bit. I do think that mental health is really tricky. For folks who have like experienced institutionalization throughout their life, what that looks like in practice, and I'm sure a lot of you all know this already, but I may just be repeating it. It means being forced to take medication. If you're not taking medication, you're not medication compliant, you're causing issues, you're punished, right? And so kind of when we're working at dealing with mental health issues or struggles for folks, we have to understand how much violence is enacted in the current system of mental health care and how we need to make sure very much so that we are not replicating that violence and looking at what care and taking care of oneself looks like. If somebody is experiencing, if somebody would be referred to as needing like a psychiatric diagnosis or something like that, that doesn't automatically mean that they need to be medicated to survive. And just kind of delineating from these pathways that like, if you're not on meds, you're not taking care of it. And I do think that this is another pathway where we can look to community for support, specifically around mental health. I know in the community that I'm in, there is like a network of mental health providers that are working to kind of move towards more holistic mechanisms for caring for oneself, as opposed to just saying, okay, everyone needs to kind of go through the same pathway. So this is where I would say, like, look at referring out, look at the different ways that like care looks, make sure that like the person is driving what care looks for themselves, and I guess go from there. That's kind of what I'm thinking.
What I'll say is that I think that when we're looking at housing services or shelters, often they have a like zero tolerance policy for certain behaviors or what we would consider to be like problematic behaviors. And I think that that is a bad policy. I think that that's a policy that will alienate a lot of folks, right? When we're talking about mental health issues and where you're not able to like require other supports or you're not even able to provide other supports, I think that kind of thinking about like removing that type of zero tolerance policy, and I feel like we've probably all seen this in place where, you know, if someone causes a disturbance, then they're immediately kicked out. If
Yeah.
someone is yelling, they're immediately kicked out. Like if anything like that, when we know that the vast majority of people who have mental health issues are not particularly violent, don't serve as like a danger to others, probably more likely serve as a danger to themselves, and it's to their benefit to be in like have access to housing services and to have access to shelter would better their circumstances, and again like allow them to over time be able to access certain resources should they want to access them. And but because of these types of zero tolerance policies, it doesn't allow for that to happen in the first place, right? And like Claire said, I think that goes hand in hand with not like immediately requiring people, one, that they be institutionalized at all within certain facilities, but also requiring medication or requiring certain treatments for folks, is also understanding that like a lot of those behaviors that people find to be disturbances or to be problematic don't actually hurt anybody, that aren't a danger to anybody, that really like it's more about like thinking about your tolerance for things, because realistically they aren't usually, we find that a lot of people aren't necessarily like disturbing their peers, right? If they are, it's like very minimal and it's something that can like probably be resolved via like actually interacting with that person and like reducing those things and the issues that we're talking about. And more so about like people's tolerances as service providers and as people who work within these services, right? Often folks who have no tolerance for it will then like enforce a zero tolerance policy.
And I think too, like in terms of looking at like the most severe examples, right? I know in Rhode Island, we are mandated reporters, especially in social service agencies. And if something like that does come up, there are like routes to making sure that someone is like not feeling blindsided or even further harmed in that process. A lot of it does mean dialogue, but I do think that oftentimes with this mental health work, it is the stigma of like, oh, we as service providers are talking about this person and not including them in the conversation. We are talking about how to take care of them without asking them what care looks like to them and not understanding how to actually create a solution that is self-directed. We are saying like, oh, we need to talk to their doctors. We're not saying all of us need to sit down and have a conversation together. And I do think that like it is extra legwork, but that legwork pays off in being able to create like reducing of incidents that feel complicated and challenging to navigate, and just a better, like kind of more cohesive communication overall. I do think that like this is one of the areas that we are oftentimes mistaken, but like accurately mistaken for like enforcers because of the way that like social service providers have acted for as long as social services has existed. And so there's a lot of reason why we wouldn't be trusted in these cases. And I do think that the first step of like that is acknowledging like that there's so much reason to not be trusted. And we have to work to a space of building trust to be able to really focus on supporting.
Okay, we have another question that came in before the webinar. I don't know how familiar either one of you are with motivational interviewing, but this next question is around that. So the question is how to use motivational interviewing to encourage engagement and participation in available services without requirement. And I know this is one of our top questions that we are always asked around engagement. How do we encourage engagement and participate in services without making it a requirement?
I have a lot of thoughts about motivational interviewing.
Yeah,
I'm
I was gonna say
somebody
that as well.
I mean, I get really worried about motivational. I mean, while in a lot of ways, like I do think it's an incredible tool, I do get worried as I recently heard a story about like a juvenile corrections facility utilizing motivational interviewing, and I'm worried about this tool being utilized in these institutional settings to reinforce these carceral systems. So I'm very wary and like talking about this, but I do think that like how to use motivational interviewing to encourage engagement. I think that the biggest thing is figuring out like what participation looks like, what engagement looks like, and being able to first figure out that. I do think that like it's not just going to be immediately like, oh, one time you told me that you wanted to do XYZ, here's a list of XYZ things for you. It's really just being able to kind of give this space for people to say like, oh, I kind of like this idea, but I don't like this idea, but maybe I would do this. And like being able to kind of work together to workshop. What do timelines look like? What do resources look like? What is all these different kind of like tools look like, and how do we use them, and kind of just creating that platform. Like that is motivational interviewing, is just being the resource that can like help support and directing in certain directions, but ultimately the person is determining themselves. Does that make sense?
Yeah, that makes sense.
I mean, I think I also share hesitations around motivational interviewing. I generally just like have hesitations about any practice that seeks to like move someone towards a behavior change that the person whom is like employing it is trying to elicit, right? I think that if someone tells you that they want to change a behavior, it's a very different dynamic to interact with them and like help them do that versus trying to like elicit that reaction from them and trying to get people to interact with you, right? And especially when we're talking about engagement and participation in services, like again, I don't believe that you necessarily can get somebody to do it like if they don't want to do it without being coercive. It's one thing to like be there with them, right? One, to present the option, to also ask questions about why they don't want to do something, right? Like I think that that's totally okay to ask like, okay, why don't you want to do this? Why don't you want to engage with this? Whatever, right? Like it feels like something that you would be beneficial to you, right? Versus like trying to get them to engage with something that they otherwise don't want to engage with, right? And again, it's about shifting our mindsets around us knowing what's best for them and knowing like saying that like, oh, if you engage with this service or you participate in these programs, that like that will benefit you and that that's going to be best for you. Because the truth again is that we don't know better than them on how to live their life. So I personally push against the idea of like engaging any sort of methods and like, you know, types of techniques that kind of try to get people to do a behavior change that we're seeking in them.
And just kind
Okay.
of just to tag something really on, and like in talking about behavioral change, we can't talk about behavioral change without looking at structural change and the systemic violence that has led a lot of folks to where they're at currently. So if your organization is not doing that, how, just think about the macro when we're thinking about where we're at right now. Just want to add that.
Thank you both. Our last two questions are around research and data. I know we want to be mindful of time, so we have about 3 to 4 minutes to answer these last two questions. So those questions are: what research materials, reports, journals, articles, books pertaining to this work would you recommend? And how can we think about convincing data-driven minds to support this approach? So all of it is about gaining resources for this approach, any type of research.
So I'll start by answering this. One, I'll start by saying that I am very data suspicious. I don't necessarily think that data is necessary to understand lived experience and also what people know. And like I mentioned earlier in this training, the approach that we take and that we have is rooted in a historical method and practice and strategies used by Black, Brown, Indigenous, Latine queer and trans folk who do community work and engage the community in trying to support their own communities through certain methods, right? So I think that you should engage with those, you should engage with that literature, engage with that theory, right? But also on the like note about data, there is some data surrounding this, and the specific examples, I have some of the links which I'll have like Shikari and other folks from the Freedom Network team share later, after, when they send everyone materials. But there are certain studies around specifically low barrier cash transfer, which isn't necessarily anything that people within this program can do or necessarily are allowed to do, but is an example of a type of service that is made low barrier and what it looks like and what it can achieve when it's low barrier. And there are specifically studies around New York City, which is where I'm based, about the success of that and how it betters people's outcomes, and also what the cash transfer is often used for in this particular case and research. Because in New York City, when they did this study and looked at low barrier cash transfer to low income folks, specifically those who were Latine in the city, that most of that money was used towards food, housing, regular necessities, and that it bettered the outcomes of the families and the folks who got this cash transfer, which often, in terms of talking about services like cash transfer, people often think, oh, well, if you provide people with cash, if you provide people with XYZ things, then they'll use it for things that we don't want them to use it for. And again, I don't personally care if they do that, but the research would tell you otherwise, right? And that also applies to other sort of services as well. But we will say that like this is a under researched area, right? So there isn't a ton of data surrounding specifically providing housing with a voluntary services approach. You won't necessarily find studies or research surrounding specifically a voluntary services approach. You'll find a lot of studies around like low barrier services, and you'll also find a lot of studies around low barrier services in other countries, not necessarily in the US or just like broadly in North America.
Okay, thank you for that. And I think that's all the time we have today. We do want to thank you for attending today's webinar. We hope that this information has been very beneficial and will be useful to you all. We would love to know your thoughts on this webinar and if it has been helpful for your work. So much so, please. So sorry, I'm stumbling on my words, trying to be mindful of time. It will be beneficial for us if you will complete the survey, that link that we're going to drop in the chat. We will be sending out a webinar recording. We will be sending out slides with this webinar recording. And again, if you would like to receive a certificate or if you would like to join our listserv, please visit us at training@freedomnetworkusa.org. Visit our website, join our listserv. And again, thank you for attending today's webinar, and we will see you next time. And give it up for our presenters for such a great job today. Thank you.